Hello everyone, this is Dr. Shishma Sarila, consulting homeopath at Fidicus Homeopathy. Now let us know about the types of myomectomy. The first type is called as abdominal myomectomy or open myomectomy, and the second one is called as laparoscopic myomectomy. The third one is called as robotic myomectomy, and the fourth one is called as hysteroscopic myomectomy. Let's go deep into the topic about these types of myomectomy to know what are the uses, when they should be performed, and what are their side effects. The first procedure is called as abdominal myomectomy. As you can see here in the picture, it's much clearer. Here indicated, what is indicated in, it's indicated if you're having n number of fibroids, that is numerous fibroids, and also the fibroids are large. If you're having larger fibroids and more number of fibroids, they will be giving you an incision in the abdomen, and from there on they will be removing the fibroids through this procedure, which is called as abdominal myomectomy. The problem with this procedure is that if you're having keloid formation, tendency to keloid formation, or if you're having tendency to infection where because your WBC count is very low, but if you're having leukopenia, if you're having any sort of diabetes, or if you're suffering from kidney or liver disorders, this might not be the best option because there will be a problem in healing, and also the hospital time after the procedure has been done also is a little bit more than laparoscopic or robotic. So if you're preferring this, remember that this has its side effects attached to it. The next procedure is called as laparoscopic myomectomy. In this laparoscopic myomectomy, as you all know, the procedure, they will be inserting a laparoscope through a small puncture in the abdomen, and they will be removing the fibroid. It is minimally invasive in nature, but it cannot be performed if you are having n number of fibroids or if you are having larger fibroids. Only abdominal myomectomy can be doing that, but here in laparoscopic myomectomy we can only perform it for moderately sized fibroids, and the hospital time for this is a little low compared to the abdominal myomectomy. Next, coming into the robotic assisted myomectomy, this is almost just like your laparoscopic myomectomy, but the surgeon or the person who is doing it will be using robotic hands to perform this myomectomy procedure. Here, what are the problems with it is, if you're having a larger fibroid, you cannot undergo this process, and also if you're having n number of fibroids also, this process is not that useful. You should better go for abdominal myomectomy rather than a robotic or a laparoscopic, because they both treat only moderate sized fibroids. The next type of fibroid is called as hysteroscopic myomectomy. What is hysteroscopic myomectomy? Remember, if you're having fibroids inside the uterine cavity, which is called as submucosal fibroids, then what they will be doing is they will be inserting a hysteroscope into the vagina region to the uterus, so that they can view the inside of the cavity of the uterus. And if this submucosal fibroid is very small or very moderate in size, where you can pass it through the vagina, then they will be performing a surgery to remove that fibroid. So this cannot be performed in youngsters or in teenagers or in people who haven't yet married. So this can only be performed in people who are already married. So this is one of the backdrop of hysteroscopic myomectomy, and also the other backdrop is it should only be a submucosal fibroid, or it should only be a fibroid which is moderate in size for this surgery to be performed. It is most useful in submucosal fibroids, but the fibroid size should be very small. If you're viewing this video, if you're someone who is suffering from fibroids or any other female reproductive organ diseases, Fidicus Homeopathy is the answer. Here we have two kinds of consultation options, the one being online consultation and in-person or offline consultation. If you're staying near the nearest branch of Fidicus, you can come and consult us in person. If you're staying far away from us, you can consult us online through audio consultation option or through the video consultation option. After the consultation has been finished, we will ask you for needed investigations. If you have already done the investigations, you can share it with us. After doctor consultation and case taking, especially to the online clients, medicines will be door delivered to you. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. Apart from that, anywhere across the globe, it can take 4 to 8 business days for our medicines to reach your doorstep. If you want to contact us, you can call us on this number, WhatsApp us, or message us. If you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who is suffering from fibroids, endometriosis, adenomyosis, PCOS, PCOD, or if you're suffering from dysmenorrhea or any sort of female reproductive organ diseases, you can count on Fidicus Homeopathy, because Fidicus Homeopathy stands for highest chance of health. Here we are following three basic principles. The one being highest success rate. We are already treating these kinds of cases and we have really good success rate in them. The second one being the transparent treatment. Here there is no gray area between the patient and the doctor. The prognosis of your case will be clearly explained to you. And the third one being the personal care. And personal care here at Fidicus is top notch. Here we will be busting all your myths, we will be educating you on all your queries, and also we will be advising you on what to do and what not to do, like the precaution. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.